Now to another big story on the continent. In the Democratic Republic of Congo is saying only about 50% of Ebola cases in the country are being identified. The government's response coordinator, that's Jean-Jacques Muyembe, has warned that the current deadly outbreak could last for a period of up to 3 years. Muyembe also added that the man who died this week in the city of Goma on the Rwandan border had 10 children and had already infected a number of people. There have so far been 4 confirmed cases in Goma with 2 deaths. This latest outbreak of the deadly disease has so far killed more than 1,800 people. Earlier this week, Rwanda briefly closed its border with the DRC. Efforts to control the outbreak have been hampered by violence against healthcare workers or Ebola treatment facilities. The World Health Organization has since declared the outbreak as an emergency of international concern. All right, for an update on that developing story, we're now joined in studio by Guilhem Molinie. He's the General Director from Doctors Without Borders, Southern Africa. Good afternoon, and thank you so much for coming through to the SABC News Desk.
Good afternoon, Kashne. Good afternoon to the people watching SABC.
Okay, just give us a sense of the scale and magnitude of the Ebola outbreak right now.
Well, DRC is a very big country, and a lot of the areas that are affected today by the outbreak are rural areas, areas where a very long, protracted conflict is happening since more than 25 years, and some areas are very difficult to reach because of that. There is also a certain fear from the communities in those areas to see government, doctors and international staff entering their communities because somehow there is a loss of trust. You have to know that many of these areas were opposition areas in the last presidential election. So it's a feeling of distrust from these communities, which makes our work much more difficult.
All right, there seems to be a huge challenge around identification of the cases. Doctor, why is that?
Well, the most important strategy in fighting an outbreak, and particularly an Ebola outbreak, is trust from the communities and somehow understanding and adherence to the protocols that health practitioners are trying to set. And that's one of the very important challenge that we are facing today. The Ebola disease can take up to 21 days to show its symptoms. So you can be somehow fine, having some symptoms of, for example, malaria or some diarrhea, and you can continue your life and infect your loved ones without even knowing it. And if you distrust the health system, you don't go to see a doctor, you don't go to the health center nearby. It means that you will continue to infect more people. And in this distress, after if you're identified as an Ebola patient, but the family is scared, then probably they will all try to escape and will not revert back to the health system. So that's one of the big challenges that we face today in Congo.
Tell us about the protocol that you've mentioned around Ebola patients and in the villages that should be followed, and why is it not being adhered to?
Well, there's a part of education about the disease. As I told,
about awareness.
Awareness, for sure. But there's also something less important is the distrust in the health system, and somehow the government health workers and the international organizations. As you know, later in the year, health centers and Ebola treatment centers were attacked.
Yes.
So in a way, this distrust is the key challenge today to fight the epidemic. That's why in Goma, which is one of the biggest city in eastern Congo, the challenge was to make people aware before the disease would come, to make sure that, for example, we could discuss with pharmacists, with traditional healers, with local doctors, to make sure that they would quickly refer any case that is suspicious to the nearest treatment center.
All right, when it came to the attacks on the treatment centers, what kind of damage are we seeing there? Are those centers able to open and operate again, or are you looking at a complete shutdown?
So the centers that were attacked in last February were reopened since then, but Doctors Without Borders withdrew from these centers. The Ministry of Health stepped in. We reopened some centers in Bunia, in Ituri, and in Goma we support the General Hospital, the isolation area of the General Hospital, but we are also rebuilding an Ebola treatment center. The difficulty is that when you have an Ebola case that enters in a general hospital, not knowing necessarily that it's Ebola, it can infect the health practitioners, other patients, everybody. That's why there is a need to somehow to isolate the more possible those patients, and at the same time to make sure that communities don't see those centers are places where people go to die, because if we take cases soon enough, we can. Chances to survive are more or less 1 over 2. So people have chances to survive, and we have some Ebola survivors, obviously.
Can you tell us what's your perception of the response of the Health Ministry right now, and the relationship Doctors Without Borders enjoys with the Health Ministry or Health Department at this point?
Well, we are present in Congo since more than 30 years now, so it's a long collaboration. It's a long-standing collaboration that we have with the Ministry of Health. Now, the Ministry of Health has intervened in 10 outbreaks, 10 Ebola outbreaks. So I would say they are rather prepared. They know well what to do. The difficulty is the amplitude of the epidemic. When the epidemic gets out of control, this is when even the normal structures of the Ministry of Health are heavily challenged to do their job.
Right. What needs to be done to prevent the spread of new infections at this point?
Restoring the trust from the communities, which is a hard task, to be honest, nowadays. Making sure that all the health system is prepared to receive patients. So not only the Ebola treatment centers, but the normal health centers should be ready to receive a patient that presents some symptoms. Today in the Ebola treatment centers, we receive more or less only 13% of the cases are confirmed cases. So you can imagine that all the other people coming are having malaria, diarrhea, other diseases. So it's very important that the normal health system continues to function, but is prepared to face an Ebola patient. Then safe burial procedures are ultimately very important, and contact tracing. So to be able, as soon as you have one case, to be able to identify around that case the family members, the friends, all the people that could be in contact, to vaccinate them. As you know, today we have a vaccine that is in an investigational phase, but it's what we have today, so we are using it. And the Ministry of Health is using it in DRC. We have more than 170,000 people that have been vaccinated today, health workers mainly, and then all the second contacts.
All right. When it comes to the rollout of that vaccine, what are the challenges around that rollout, especially in the rural areas that you've mentioned, where accessibility and violence is such a huge challenge?
For now, the strategy is a ring vaccination. So somehow you try to vaccinate around the cases. We don't have enough vaccines to vaccinate everybody today. There is some question mark on the capacity of the producers of the vaccine to supply all the vaccines needed. So for now, we are still on a ring vaccination, trying to compound the number of people vaccinated around the cases that we identify. So that's the big challenge that we have today, identifying the cases, the contacts, and being able to vaccinate these contacts.
All right. We've gotten reports that Rwanda briefly closed its border with the DRC. Now, what kind of controls or infection controls would we see at the border?
Yeah. So since the declaration of the international emergency by the WHO on 17th of July, this was our fear, that border would be closed. Why? Because when you close a border, people tend to cross it by other ways.
Illegal means.
Exactly.
Yes.
And that's what happened in Uganda sooner this year, where actually people that were affected by Ebola did cross by illegal ways. So what we recommend is keeping the borders open, but making sure that the borders obviously are points of detection, where people that are possibly carrying the disease could be identified and treated. It's also important that the borders remain open, so that the areas that are affected don't suffer from more than the Ebola outbreak. As you know, today we are talking about Ebola, but you have a conflict, you have an important measles outbreak as well that is affecting DRC. Countries need to continue to be working when such kind of disease happen.
All right, this current outbreak, we're told, could last for a period of up to 3 years. Is there any way at all that we could contain this in less than 3 years? What needs to be done for that to happen?
Yeah, it's so
difficult
convincing people. I don't know how long does it take to convince people in rural areas, but this is something that is key today. Making sure that, as I told you, making sure that the health system is reinforced, not only on the Ebola section, but the entire health system is strengthened, so that let's say people that have other disease can be admitted, taken care of, and reassured, and somehow cases to be identified. So it's a race against time. It will require a lot of collaboration between all the actors that are intervening in the outbreak, and probably a little bit of luck as well.
Thank you, Doctor. That was Dr. Guilhem Molinie. He's the General Director from Doctors Without Borders, Southern Africa, joining us on the desk this afternoon. Time now to take a short